Hi, I'm Dr. Ronald Adams, and today I'm going to be talking to you about diabetes. So what is diabetes? I'm not talking about what your doctors told you. I'm talking about what is diabetes to you. To most people, it's fear and frustration. It's the frustration of not being able to do the same things that everyone else does. It's the frustration of missing out on birthday parties, weddings, family events, or just being able to play with your kids or grandkids. It's the frustration of barely having enough energy to make it through the day because of poor sleep. It's the frustration of having to get up and down all hours of the night to go to the bathroom. It's the frustration of not being able to eat the way you want to eat. It's the fear of losing your vision, the fear of having burning or tingling or numbness in your hands or feet, and it's the fear of losing body parts. So let's look at diabetes from a medical perspective. Simply put, diabetes is your body's inability to regulate glucose or blood sugar. From now on, whenever I say glucose or sugar, I want you to think fuel. Why fuel? Well, glucose is the fuel that runs every cell in your body. But this fuel has to be provided in exact amounts. Too much, and the cell will pop like a balloon with too much air. Too little, and the cell will die of starvation. I'm going to use the web of dysfunction to describe what happens when glucose regulation goes wrong. So this is our web of dysfunction. In the center is diabetes, or you. At the very top, we have the brain. Symptoms of sugar regulation that affect the brain are brain fog, anxiety and depression, or short-term memory loss. Diabetics will typically have problems with the gut, things like food sensitivities, constipation, diarrhea, or even leaky gut. Now, diabetics, as well as people with insulin resistance or reactive hypoglycemia, as well as having brain and gut problems, can also have problems with the liver. And some symptoms we would see with liver problems would be cholesterol being elevated, triglycerides, even have greasy stools. Diabetics can also have problems with circulation. Symptoms like cold hands and feet, erectile dysfunction or sexual dysfunctions, numbness and tingling in the hands or fingers, and amputations in some cases. People with problems regulating glucose can also have adrenal symptoms, things like poor sleep, fatigue, stress management, and also headaches. Poor glucose regulation and thyroid problems can go hand in hand. Symptoms like weight gain, hair loss, mood swings, nervousness, and even infertility. So what are we ultimately trying to achieve? Quite simply, balance. Now that sounds simple, but can we do it on our own? Probably not. Most people will need guidance, direction, and mostly support. The question I get most often is, where do I start? Well, it's pretty straightforward. We have to find out what's broken. Now there's very specific lab tests that you'll want to help identify the triggers that are fueling the fire we call diabetes. Why do most people fail at getting healthy? They lack guidance and support. Here's the support we offer. We eliminate trial and error by designing a program based specifically on your lab test results. One-on-one consultations where we'll sit down and make certain that you stay on track. We offer telephone support. You have a question, you call, we'll answer your question. If you have a very busy lifestyle, we can even do this through the internet. We are a team with a common goal, and that's to help you reach optimal health. Thank you.